One, two, three. Mic check. 1, 2, 3. Coronavirus task force. Mic check. 1, 2, 3, 4. Mic check. Good. Check. 1, 2, 3. Mic check. 1, 2, 3, 4. Mic check.
Mic check. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Just watch the camera, make sure it doesn't fall down. How are you? Good. I'm a sign language interpreter, so I try not to hit you when I'm signing. No, I'm the sign language interpreter.
Oh, okay.
So I won't have one probably. Thank you, though.
Wanted to make sure we were taking care of you.
Thank you for checking on us.
Right here, Dr. Piercy. Who is here and here? Right here.
Hello,
I know, but
and welcome to the meeting. Please enter your passcode followed by the pound or hash key.
yes, done and fill.
Please hold while I confirm your passcode. Thank you for joining Global Meet. You hear the tone, you will be the sixth person to join the meeting.
Good afternoon, everybody. Thanks for coming this afternoon to the first meeting of the Governor's Coronavirus Task Force. Everything that will be shared here, this is a working meeting. It is on the record, and we will have time at the end for our staff from the Department of Health to take questions from members of the media. Dr. Piercy is going to be leading this meeting, and we'll get started momentarily.
Thank you, Shelley. Thank you all for coming. I have spoken with all of you over the phone, and so some of you I've never met in person, so I'm glad to see your faces. And for those of you on the phone, thank you for joining us. I would like for us to briefly go around and introduce ourselves and your role in organization, just for particularly the benefit of those on the phone and then others in the room. Dr. Long?
Yes, I'm Wendy Long, the President and CEO of the Tennessee Hospital Association.
Rebecca Kelly, State Director for AARP in Tennessee.
Martha Buchanan, Director for the Knox County Health Department.
John Dunn, State Epidemiologist.
Lisa Piercy, I'm the Commissioner of the Department.
Mary Margaret Phil, I'm a medical epidemiologist with the Department of Health.
I'm Ken Sands, I'm Chief Patient Safety Officer and Chief Epidemiologist for HCA Healthcare.
Doug Krulin, President and CEO of the Nashville International Airport.
Bradley Jackson, President and CEO of Tennessee Chamber of Commerce.
Mike Krause, Executive Director, Tennessee Higher Education Division.
And then we have one more member in the room. We're getting to the table right now.
Penny Schmidt, Commissioner of Education.
And folks on the phone?
David Love, Director, FedEx Farm Bureau.
I heard Jeff Aiken, Farm Bureau. Somebody else was talking?
Dave Lusk, FedEx, Global Security Operations Center, Crisis Management.
Thank you. Who else?
John Mormon, ETSU Health Infectious Disease Chief.
Thank you. Anyone else?
Holly Sullivan, I lead Global Economic Development for Amazon, responsible for the National Corporate Office and also on our internal COVID-19 task force for Amazon.
Thank you. Anyone else?
Sarah Cross, Infectious Disease Chief at Regional One Health in Memphis.
Got it. I think that about covers it. Did I miss anyone? Okay, we'll go ahead and get started. You have an agenda there in front of you, and we will start first with some clinical information. I want to make sure we're all on the same page as far as what the actual disease process is, and some clinical guidance. And so for some of you this will be new, for some of you this will be very familiar. So I will ask Dr. Mary Margaret Phil to give us some clinical background.
Sure, so as all of you are aware, there's been the identification of a novel coronavirus that originated in Hubei province, China, identified at the end of 2019, which has now been named COVID-19. The causative agent for that is SARS-CoV-2, so you might see both of those terms used interchangeably. This disease was identified as an outbreak of a cluster of unidentified pneumonia in Hubei province, and very quickly health authorities in China identified this novel coronavirus. Obviously, since that time, we've seen fairly rapid global spread around the world, including now within the United States. I think important to note that from the data that we have originating from China, it appears that the vast majority of patients infected with this virus exhibit mild symptoms. Most don't need medical care. On the average of 80 to 85% have a mild lower respiratory illness, often characterized by fever, cough, occasionally shortness of breath, sore throat, or other lower respiratory type symptoms. We do see that about 15% of patients require hospitalization, and about 5% of patients require more intensive levels of hospitalization, such as critical care. I think It is also important to note that the information we know about this virus is still rapidly evolving. There are virologists around the world that are doing basic science work to try to understand its pathogenesis. There are clinicians doing studies to try to understand how it presents and spreads among patients. And then, of course, work being done to try to determine if there might be effective countermeasures, such as a medication or certainly vaccine development is underway. I think that's probably a high-level overview.
And I should also mention that we'll have time at the end of this for your questions. And then if you didn't see it on the agenda, we'll also give you an opportunity, if you want to share anything that your organization may be doing or any questions or concerns or needs that you may have. So just wanted to give you a heads up that that is coming later on the agenda. I'll now turn to our state epidemiologist, Dr. John Dunn, to talk to you guys about our preparedness efforts and specifically including in his comments about supplies, since that's been a hot topic.
Great, thanks, Commissioner Piercy. So I guess first I'd like to say that in terms of our preparedness, we have a number of different programs. Within the State Health Department, we have a public health emergency preparedness program. We work very closely with TEMA. In fact, we have some of our staff that are embedded within TEMA so that we have seamless communication. So that's at the state level. Our primary partners in the field are with our regional health departments and with our metropolitan health departments. So for example, with Knox County with Dr. Buchanan's team there. So that's a big part of our preparedness effort. We have a number of systems in place whereby we can track resources with the medical community, the health resource tracking system. We are working to push out information to all of our partners so that as the clinical guidance and information changes from CDC on a weekly or a daily basis, that we are sharing the best available information with facilities and with providers. So a large communications effort around preparedness. So in the past, we, in terms of supplies, from the days of pandemic flu, we did have some caches of supplies at that time. We have long since not had those supplies on hand, but we've been having high-level discussions with the team from the governor's office, with TEMA, to see what supplies are needed. We're going to be using our HERTZ system to reach out to medical facilities across the state to gauge PPE needs, which masks are part of PPE. We're also working closely with CDC to review the guidance that's available. We typically start these types of responses with the most conservative approach to do testing and take care of patients, but we want to find the areas where we can most appropriately respond and still protect our providers and have the appropriate PPE on hand to do the work we need to do across the state.
Thank you. I'll pause there for questions from a clinical standpoint or a preparedness standpoint before we move forward. If you think of any, I'm happy to take those anytime. A bit of a situational update. Many of you probably saw our release this morning. We have confirmed the 4th case, and those patients are all being taken care of and working with their local and metro health departments on contact tracing. They're all appropriately isolated, and they are all aware of their diagnosis. I do have some updates for you on testing. We have tested a total of 49 patients. Again, we have 4 positives. We have run 49 tests. At the end of last week, we reported that we had 85 tests. Fortunately, we have doubled that capacity now. Given what we've tested over the weekend, we now have availability of around 165, at least 165 tests. We are continuing to get supplies in, so we actually may have additional capacity. But I also want to talk to you about commercialization, because that's going to somewhat change the game on testing capacity. On Friday, LabQuest came online for commercial testing, and then today, Quest was scheduled to come online for testing. There's a 3rd large commercial lab provider called AEL and it's expected that they will have commercialized testing by the end of this week, or in the coming days, I should say. So the game is about to change for testing. We will very soon, imminently, move from not only state health lab testing, but also commercial availability. The state lab will continue to test, but the capacity will be significantly expanded given this commercialization. I'll pause there and let Dr. Dunn or Dr. Phil add in any details about testing.
No, I'll just add that we also have heard from several of our hospital partners that they anticipate that hospital-based testing may be available in the coming days and weeks, and we'll continue to communicate closely with them to understand how they can support the patients in their communities.
Yeah, Commissioner Chris, I'll just mention that the type of response we're in right now is something that we've, of course, have gone through in the past with pandemic flu, with West Nile virus, with Zika virus, and I'm really proud of our laboratory and our health department partners, because what we do in these circumstances is we step into this gap where there's not diagnostic testing available, there's not good clinical testing guidance available, and we're standing up testing in our state laboratory with our state public health partners until our regular medical system can get up to speed, get the testing on board, get guidance out to clinicians. So we're in this response phase where we're in between, where we 2.5 months ago did not have a test for COVID-19, but now we do, and it's been pushed out from CDC with state lab partners all across the country, and we're doing testing, trying to identify cases while the system gets in place to respond as we normally would with our medical system.
Thank you for that additional detail. Something else that you will start to see transition as more tests come online is our case reporting. What you will probably see, or what you have already seen, even as of this morning, in this morning's release, you probably noticed that we said an adult female from Middle Tennessee. That is different than what you have seen in the past, and I want to give you a little bit of context of why that is. So let me first say that in typical outbreak reporting, as Dr. Dunn just mentioned, and quite frankly, the department has dealt with outbreaks for years and years, we typically report Grand Division level only. And that's important to know. It's important to know why we do that. Fully acknowledge and understand that everybody wants to know the county because everybody wants to try to determine their own risk. That's understandable. But we also have to keep in mind that we're talking about patients here, and we're talking about doctor and patient relationships. And patient privacy is very important to us. And while it might be easy to blend in a very large community with several 100,000 people, when we have counties that are very small and rural, the risk of re-identification is very high in those counties. And so in an effort to protect patient privacy, if they are not in a metro area, then we will report Grand Division only. However, please hear me clearly. We know exactly where the patient is. We are taking absolutely every measure to identify all of the contacts and all of the potential risk, including schools and employers and the community at large. And so if that information becomes a public safety concern, we will absolutely be able to give that information. But out of respect to the patients and patient privacy, you will see our reporting outside of the metro areas to be by Grand Division. Now, why am I making the distinction for metro areas? As Dr. Buchanan knows, because she runs our Knox County Metro Health Department, the 6 metro areas are separate jurisdictions from the state health department. We are partners and we work closely and have great relationships, but she is the city health official, the county health official for Knoxville and Knox County. And so if Dr. Buchanan identifies a case, then she can report that. We've seen that over the weekend in Memphis Shelby and in Nashville Davidson. And so right now, you will start to see grand division going forward. Of note, as I mentioned in the press conference on Thursday, we did identify the first patient's county because that was very shortly after the tornadoes and the severe weather, and we didn't want to make that situation any worse by being nonspecific about that case. So also, while we're talking about reporting, starting tomorrow, you will see a live update on our website every day at 2 p.m. to update the case count. Not only is that important for flow of information, but as we start testing in the community through commercialized testing, these conditions are reportable to the state, but we may not have real-time results up to the minute because we're not running the actual test. So we will batch those results and post them on our website every day at 2 p.m. I'll ask my colleagues to fill in any gaps on the testing or case reporting. The final thing I had on my agenda that I want you to be aware of are our efforts for specialized plans. If you have been keeping up with the national, the way this is playing out nationally, one of the very high-risk areas that seem to be affected are nursing homes and vulnerable populations in residential facilities. So we have been proactively working with our nursing homes. We pushed out information towards the end of last week for those groups and are working specifically with those populations on visitor guidelines, patient isolation, testing procedures, and engaging with them actively to make sure that our most vulnerable citizens are taken care of. Other comments about nursing homes? Okay. That concludes our prepared remarks. What I want to do now is I'll start with those in the room first, and then I'll go on the phone. If you would like to share what your organization is doing, or if you would like to share any concerns or needs that you have to raise those, you're welcome to do so. So since we started with Dr. Long last time, I'll start with Commissioner Schwinn this time.
Yes, ma'am. So I think first and foremost, the only thing I want to say is that we've been very appreciative of the partnership and getting information out so quickly to schools. I think certainly parents with young children in our schools absolutely want that level of information, and so that's been really helpful for us to push out to schools across the state. And then I think we've also been trying to help support some of the kind of best practices that we would want to see, that we would see in any kind of food prevention as well. So that has been incredibly helpful, and I think we will continue to do that. What will continue to also be helpful is as you're pushing out information, making sure that as we're trying to craft that in a way that is user-friendly for our K-12s, making sure that we have that level of review and make sure we're putting out accurate information. So appreciate the partnership on that.
Thank you, Commissioner Schwinn. I don't necessarily want to go down the road, but you're up next, Mike.
Yeah, absolutely. Echo the commissioner, greatly appreciated the department for what has become daily communications. Higher education's primary concern is we have a significant study abroad program that is currently in flux. We are focused first and foremost on getting students home from level 3 countries. Second, we're of course leaning forward to determine about pending study abroads. The majority of our institutions have canceled all study abroad for the foreseeable future. Second, we're focused on communicating with our student health centers. As you know, our campuses, all of our university campuses have their own medical staff, and ensuring that they have the right clinical guidance from the department has been very important. And then finally, our campuses are small towns, and ensuring that all of our presidents are carrying out the appropriate level of emergency preparedness, whether it's a tabletop exercise or implementing all the guidance we're receiving from the department, is probably our third aim. We are convening in communications with our presidents on a daily basis as driven by guidance we get from the department.
Thank you.
On behalf of the Tennessee Chamber, thank you all. This information has been very helpful. Tennessee Chamber, we've done a number of things in addition to establishing our own website that we promote across the state. We've sent that out to all of our local chambers, and local chambers then have connections into communities, in the business community. So one of the things that they include on there are resources for employers. We've also convened a working group of some of Tennessee's larger employers to figure out kind of daily what are they doing, how internally and who within the company are they receiving updates, and then sharing that information with the other businesses too. I think they want to be in the know that if cases at a major employer are revealed, how do they react and what are their next steps. So.
Thank you.
Doug Krulin, Nashville Airport, represent the 5 air carrier airports in Tennessee. Our biggest challenge is we're all open 24 hours a day. We get people entering from all different counties, and so we're really focused on cleaning to make sure that the airport is clean, so we clean around the clock. We have contingency plans that we've worked with Metro Health and the state to implement in the event that somebody gets sick at the airport, and all of the hospitals have been very helpful for educating us on what we do. The majority of our police department is not only policemen, but firefighters, but also EMTs, so that's your liaison to the passenger that will be turned over to public health from there. So our biggest concern would be supplies down the road. As everybody purchases supplies, how do we keep the supplies up that we need? And from hospitals, obviously, but if you're going to run 24 hours a day, you need supplies, so that's what we're working on.
Yes, sir. Thank you. Dr. Sands?
HCA Healthcare is a large provider working in multiple states, and we have 2 principal concerns. One is being able to maintain our mission and doing the best things for our patients, and the other is protecting our workforce and making sure that they're available to be meeting the needs of those patients. We're especially appreciative that the state is working hard to align guidance with the CDC guidance, which is changing frequently, as you've referenced. It sounds like you're working hard to stay one step ahead of that guidance and know where it's going. We have found that it is really key when county and state and CDC guidance are in alignment. It allows us to give a much clearer message to our workforce in terms of what is the right thing that they can be doing to protect themselves and to be following the right guidance for our patients. We are also very interested in making sure that we are able to have care occur in the appropriate settings, and as you've referenced, we are going to see this to be largely an ambulatory disease, since the large population probably will not need hospitalization, but they are going to need care, and we need to be thinking through what are the alternative methods for providing care, alternative settings for care, so that our inpatient facilities can be really preserved for those that need that level of care.
Thank you. I'll go to this side of the table. You're not obligated to share, but if you'd like to share, you're welcome to.
Well, I'll go ahead and share. I mean, this feels like what we do every day at a very intense level. We're working with our community partners, hospitals, employers, the University of Tennessee, and many others to provide information for them as rapidly as we can, relying heavily on the Department of Health and the CDC for that information, and really appreciate the response by the Department of Health. One of our concerns that's come up is it's around supplies. Hand sanitizer, we're getting a lot of asks for how do we get hand sanitizer. And then our communities of faith are seeking guidance, and we don't have great guidance for them. They're employers, but they're different, so communities of faith is another thing that we need some guidance on.
Thank you.
So just with AARP, we are working to stay in communication in the preparedness at all levels, local, state, and national. Tomorrow we're having a national telephone town hall with our volunteers, who are sort of our connections to communities, trying to be real clear about who is at risk and who is not. It's not all people over 50 or all people over 60, but the populations within that, and then just using URAL's guidance and the CDC guidance and moving forward with caution. We also are concerned at the limitation of the things that can keep us clean and safe.
We
have.
very closely with the Department of Health and are having weekly calls with hospitals to keep them up to speed on things. And I think obviously our needs are going to change over time. Probably the most immediate concern is that we don't see hospitals get overwhelmed with the worried well and the worried mildly ill. And so I think messaging to the general public about when you need to go to the hospital and when you need to be tested, I think is really important at this stage of the game. When it comes to the commercial testing, what we're hearing, and I think it's important that the public understand, is that while the labs are going to be prepared to run the test, they're not taking the samples, so it's not like when you can go to West or LabCorp and have your blood drawn. So that actual messaging about who needs to be tested and when you need to go to the hospital or other healthcare provider to have it.
That's good feedback. Thank you. We'll move to the phone now, and for simplicity's sake, I'll call a name, and if you have an update, that's great, and if not, you can pass, and that's no problem. We'll start at the top. Jeff Aiken with Farm Bureau.
We are currently monitoring the situation to see if there's a need for us to perhaps cancel some meetings that would bring multiple people in from across the state. We have not made any decisions on those as of yet, and have canceled some travel for some of the employees already.
Thank you. Dr. Cross at Regional One Health. Mr. Lusk at FedEx.
Yes, good afternoon, and I appreciate the opportunity to participate on this collaborative effort to protect the people of the state of Tennessee, including FedEx team members and our customers. We activated our 15-year-old pandemic plan back on January 13th. As you can imagine, we have a presence everywhere around the world, over 400,000 FedEx team members in 220 different countries. So we were first pushed into action with the outbreak in Wuhan province and worked very diligently over there, as well as continue to prepare the rest of the regions around the world, including the United States. We transitioned to a response, from planning to response, about 5 weeks ago, working on those most critical things that we could have an effect on as a business in our country, which is hygiene. Following the strict guidance of the CDC and WHO, for the past 5 weeks, we have been building on muscle memory in our team members on the consistency of washing hands for 20 seconds, using hand sanitizers, Santa wipes in the workplace, but it doesn't stop there. We've also coached and educated on continuing those practices into our team members' homes and thus into the community to ensure a whole of community approach, if you will, in protecting the herd, if you will. We are continuing to work on those efforts and are responding not only within the state but across the country. We operated moved a federal medical station yesterday from Baltimore to Oakland to prepare for that cruise ship that docked there today. So we stand by to work collaboratively in the public-private sector partnership initiative and do whatever we can. Any questions? I do have one question. Something that came up on the radio today I thought was very interesting. Recommendation from CDC and WHO of individuals that have maintenance prescriptions to work through their physician, their primary care physician, and their dispensaries to secure more than a 30-day supply of maintenance medications. And I do have a question on how capable the dispensaries are and the insurance providers in pushing out their beyond the 30-day supply for their patients. So that's a question out there for the group.
Thank you. That's a good question. I'll ask, since that's preparedness, I'll ask Dr. Dunn to respond.
Well, I haven't seen the guidance about that particular aspect, but what I will say is that the message we've been pushing is also about personal preparedness. And we want people to be able to take care of their families and their loved ones. And as we've said several times over the last few days, the tornadoes have been a great reminder to us that we need to be personally prepared, and that includes things like medications and so forth. So I can't comment on the CDC guidance that came out today. I haven't seen that. We've been doing some other things, but we certainly think that's important and goes along with our message of personal preparedness and institutional preparedness and academic institutions and businesses and so forth. So we really appreciate the approach that you described with FedEx in terms of your staff, and we want to encourage that same approach, that it trickles down into our families and into our communities.
And I'll just add that we have had some conversations with TenCare and with the Board of Pharmacy to start to address some of those issues to try to ensure that patients that need more than a 30-day prescription, to ensure that those mechanisms are in place for that to happen.
Thank you. Next on the list is Dr. Mormon at ETSU.
Yeah, so we at the university have already canceled international travel through mid-June and are bringing back our international students from high-risk areas, like most people are, as much as we can. I guess the only concern we have is with the rapid access to commercialized labs. We're already getting demands from clinicians to test people that really do not have significant risk factors, and I think that's going to come up more and more. So I think we're going to need a lot of guidance in terms of the commercialized lab, when we should be testing, especially because we don't really have a good grip on community spread quite yet. So any guidance from you all would be helpful for us.
I'll ask Dr. Phil to talk about testing criteria and how that should or maybe should not transition as we, or evolve as we transition into community testing.
Sure. Certainly there's been a lot of communication around who should be tested and access to testing in the last week or so, and we certainly are thrilled to see rising diagnostic capacity across the country. At the Department of Health, however, given our ongoing somewhat limited testing capacity, we have continued to use some criteria to determine who will be tested at our state public health laboratory. So we're still using criteria on the epidemiologic side. So has an individual had travel to a high-risk area where there is suggestion of community spread? Have they had contact with a confirmed case? Have they been named as a contact from another jurisdiction? And then certainly understanding if there's an appropriate clinical presentation that seems consistent with the syndrome that we're seeing around the world. And then most recently there had been guidance from CDC to include a carve-out of individuals with very severe pneumonia, something called ARDS, or acute respiratory distress syndrome, where the cause of that couldn't be identified. And so we've also included those individuals in our testing criteria to ensure that, in a way, it's a sort of surveillance to determine if there are people in our ICUs that might be infected with this virus that we might not otherwise know about. So we're still continuing to operate under that set of guidance, which is really the most recent nuanced guidance from CDC, while certainly working to move towards being able to test a broader group of individuals, though being always cognizant of our testing supply and wanting to ensure that the highest risk individuals can be tested when needed.
I'll just add, Commissioner Piercy, that at this time and at the beginning of the response, the message from CDC and state health departments has been the idea of containment and doing that targeted testing and doing a lot of work around those identified cases for the purposes of slowing spread and keeping our communities without those infections as long as we can. But as we're seeing around the world and in other parts of the country, especially on the West Coast, we're learning a lot from our colleagues in other states that are a little bit ahead of us in terms of what's happening in their communities. We know that guidance will be changing, and we're committed to pushing out the best available guidance that we can to providers as those commercial tests become available.
Thank you both. Finally on the list, on the phone, I believe, is Ms. Sullivan from Amazon.
Hi, everyone. Thanks for all the great work you're doing. So we've been responding to this for a couple of weeks now, and we have work from home policies in 4 locations in the U.S., Seattle, the Bay Area, New York City, and Newark. We are also on probably, am I echoing? I apologize.
You're coming through pretty well here.
Okay, great. We also have work from home policy in those locations, and we're also on travel restrictions. So that's domestic and international travel restrictions. We do require approval for any essential travel that is deemed essential through the company. We're continuing to monitor on a daily basis. Other locations, obviously, we're also handling situations in Europe.
Thank you.
Thank you.
Anybody that I missed on the phone? Okay. Before we open the floor for questions, I do want to remind everyone of several resources that we have. On the screens in the room are some of the resources that we use and we encourage you to use as well. On the screen behind me is the live map from Johns Hopkins, and you can drill down into some of that. On the side screens is our website, and that is something that has a growing amount of information that I think that everyone in this room will find useful. There's a section for healthcare providers, there's a section for public, there's a section for tabs for employers, there are testing guidelines, there are interview guides. Please visit our website. It's tn.gov/health. And there's a banner bar on the home page that references coronavirus, and it will take you to the page that you see pulled up there. Also, embedded in our page is a link to the CDC, and as you have heard all of us say repeatedly, if you are going to get information on this, please seek a reputable source. The CDC and the World Health Organization, that's where we're getting our information, and we encourage you to do the same. Some other resources that some have been mentioned today and some have not. Dr. Dunn referenced HRTS, H-R-T-S, which is the Hospital Resource Tracking System. And for our hospital providers, they are all very engaged in that platform. That helps us keep a running tab on supplies and needs, as well as bed availability and many other healthcare operational resources. We also have an email address for providers and stakeholders that need advice, not general public or not general questions, but for example, for an employer or for a question about a gathering. That's covid19.info@tn.gov. Again, covid19.info@tn.gov. That is obviously an asynchronous communication and not for any type of emergency communication. None of our resources are for emergencies. I will remind everyone that in the event of an emergency or if someone is in distress, they need to call their provider or 911 as appropriate. We do have a 1-800 number that's found on our website that is operational from 10 to 10 every day. That is for the general public for ranging any kind of questions that they might need answered. We also have a listserv where we push out information at least on a weekly basis. If you want to join that listserv, you can email us at the email address already given. Those of you task force members are already on that listserv. As Dr. Long mentioned, we are having regular stakeholder calls with hospitals and healthcare providers. And if the need arises for other stakeholder groups to have industry-specific stakeholder calls, we're absolutely happy to entertain that. And then finally, the only thing I had left is a note that I will be in contact with you about our next meeting. As this plays out over the next few days, as we've seen over the weekend, this is evolving rapidly. And so the cadence of that meeting, of the next meeting, it is to be determined, and we'll get back with you on that pretty soon. So I will stop there. Anything else to add from my team? Now we'll open up the floor for questions for the TDH team only. And so please direct any of your questions to myself or my staff.
Dr. Piercy, Brett Coleman, Tennessean. Can you tell us anything more about the suspected origins of the virus for the third case announced Sunday in Davidson County or the fourth case announced today in Middle Tennessee? Do you know if either one of those are now believed to be travel-related or community spread?
You want to take?
Sure. So the fourth case, I can just say that I know that investigation is ongoing, and I've not been privy to the details of the contact tracing that is happening. I'm looking at Dr. Dunn to see if he recalls the third case, because I don't want to misspeak. To be fair, to be honest, I don't want to confuse them, so we'll have to circle back with that information.
Yeah, well, the only thing I would add to what Dr. Phil said is that we're working really closely with our regional health department partners and the metro health department partners. There's a lot of legwork. We kind of refer to that as shoe leather work to do the investigations, to begin identifying contacts, to talk to those people, to talk to employers, to talk to locations where they might have been. So I think as Dr. Piercy said earlier, we can assure you that we are working around the clock and that we are identifying that kind of nexus of activity and contacts and so forth. But it's an ongoing active process at this point that has really been going for less than 48 hours. So we're working as fast as we can with our local partners.
You referred to the hotline. Have you tried to call it lately? I just called it 442 2 minutes ago. 6 times I've called today, and it was a busy signal. Got through once at 12:29. How many people are working it, and what are you doing about the busy signal?
So you bring up a fair question. We have had, as you can imagine, a very high call volume, and we just went live with the number on Thursday, and we're in the process of ramping that staffing up there. So we encourage people to continue calling. I understand that it is busy. We do have some overflow capacity in the email contact, as well as providers are answering lots of questions. And so if you can't get through to that line and you think you might be sick, we encourage you to call your provider.
What is your advice to people who are going out, spring break coming up within the United States, moving forward as the cases seem to continue to rise?
Yeah, I think we would certainly encourage people to obviously consult the CDC travel website. CDC and the State Department have put together travel advisories for certain parts of the world, although that's more international locations. Regarding domestic travel, I think we're fortunate to have lots of information in the media releases and events like this in our partner states and jurisdictions around the country to share, the situation in those areas, and it's important that people be up to date and know information about where they would be traveling to determine if that trip is a good idea for them and their family. And as Ms. Kelly with AARP alluded to, I think also important, and CDC has released guidance to this effect in the last few days, certainly people that might be at higher risk for complications or severe outcomes from this disease, such as individuals that are older or have underlying health conditions or weakened immune systems, should certainly make sure to consult those sorts of sources before they make decisions about travel.
Is there a plan in place for these, elderly homes where, have you gone out to any of the rural areas to make sure they're up to speed so once it does?
Yeah, so we've pushed out information through the Board of Health Licensure to every facility in the state to ensure that they have the appropriate guidance from CDC, as well as some signage about facility visitation, given the ongoing situation. And then we work very closely with our partners in the metro and regional health departments who have relationships with those facilities in their communities to make sure that they are providing the most up-to-date guidance and are available for questions or concerns should they arise.
Let me ask you.
That's not a number that we have easily accessible, but as I've mentioned, we realize that these are challenging consultations, and we've been working to make the very best decisions we can with the information that we have at the time.
Do you have estimates?
I don't. I apologize.
Let me ask this, since you have this policy of not identifying, allowing the only 6 standalone county operating departments to release information if they want to, and you don't, if you're traveling from anywhere in Tennessee, where do you know where's safe to go? You got 1 county now out of, you got 2, or I guess 3, but the latest case, there are 41 counties, you have no idea where it is. You don't know whether it's Mount Eagle, you don't know whether it's the Tennessee River, this way. How are people supposed to know where they can go or not?
We understand that concern, and we want to reassure everyone that the risk to the general public is low. These people, these patients with infections are appropriately isolated and are not a risk to the public, and so we will let the communities know if they are at risk for a broader spread. But at this time, the patients are isolated and do not pose a risk to those communities.
Commissioner, with bigger counties like Davidson County, for example, they identify the patient, we even know where the kids of that patient goes to. And that's a metropolitan county. So I'm wondering, people might be afraid of not knowing where it is, or how to better prepare. So how can you tell what can you tell the people that are scared and they are not going to know which county is which is from?
It's a fair question, and I think maybe a little education about contact tracing would help allay some of those fears. So one of my colleagues want to describe the contact tracing process?
Sure. So as soon as we identify a confirmed case, we do an intensive interview. These interviews can last hours. Dr. Buchanan can also speak to this, using any available resources to understand a person's activities during the time period where we think they might have been infectious to others. So we use tools like people's cell phones and calendar appointments, and even looking back at credit card records to understand if they made a purchase or ate at a restaurant, or identifying any other activities that they might have participated in during that time period of interest. And then based on the interactions that they had during those activities that are identified, we determine whether or not an individual would be considered a high-risk contact to them. And again, for this disease, we consider a high-risk or a close contact someone that has prolonged contact, more than 10 minutes generally, at a close range, generally less than 6 feet. So being in the same room with someone for a short period of time across the room is not considered a high-risk exposure. And so once we gather all of that information, then we reach out to those individuals individually that have been named as contacts and advise them of their possible exposure to COVID-19 and require that they then restrict their movement for a period of 14 days from the date of exposure. And then public health continues to check in on them and their health status on a daily basis.
Have you reached out to everybody that was on the flight, though, that the first person that was identified?
So the first person when they traveled was healthy. And so I think that's also important. We contact trace based on when a person's symptoms started and when we believe they were at the highest risk of transmitting to others. So during that travel, as I believe was in a press release, they were well.
We have hundreds of thousands of uninsured Tennesseans. Some cities and states have made a commitment to make sure that they can get tested or get cured, even if they don't have coverage. Is Tennessee going to make a similar commitment?
So, as you point out, we do have some uninsured citizens of Tennessee, and we will take care of them just like we take care of them now for any of their other health needs.
And how would you do that? You don't have state hospitals or anything like that.
We have multiple safety net providers across the state, as well as multiple providers that take uninsured patients. So this isn't any different than them seeking care for any other condition without insurance.
Would the state reimburse those counties, say like an Erlanger Medical Center in Chattanooga, if they're spending money on that?
There are already multiple mechanisms in place to offset the cost of charity care and uncompensated care in those facilities.
You all said that there were 49 patients tested or positive. Were the rest of them negative, or are you still awaiting results from
So the ones that we haven't announced are all the rest of them are negative, yes.
At this point, have
I'm sorry,
anyone
all
from
of
the
them
health?
what?
Negative.
At this point, has anyone from the state health department given any guidance or having any discussions with the organizers of some of the major events we've coming up, like the SEC tournament, the NRA conference, the CMA Fest, Bonnaroo, big things where lots of people come here and then get very close to each other for extended periods of time?
So the jurisdictions where many of those events are being held have already had proactive conversations with organizers of many of those events about contingency plans and many of the guidance that has been released by CDC about mass gatherings and events.
What recommendations are you giving to the employers of those patients that have been confirmed? Are you recommending social isolation with the rest of their coworkers, or what are you essentially doing?
So again, it really depends on the degree of interaction between a colleague and their coworker that was confirmed to be COVID-19 positive. And so we work really hard to understand exactly what those interactions are and make those assessments based on those nuanced details. So it's difficult to make sweeping generalizations. We really want to understand the nature of the interaction between those people.
That's going to be our last question for today. Dr. Piercy, do you have any closing comments?
I do not, except for expressing appreciation to this task force. I realize that we called you together quickly. I will give all of the credit to the governor. It was with his urging that we called you together, and I feel like we have a very good group that's brought together representing several different sectors. I also recognize the fact that this task force was announced just hours before the first case. So it was very timely, and I know that you all came together very quickly on Thursday morning when we announced the first case, and that we mobilized you very quickly for this meeting. So please know how much we appreciate your service and your expertise, and we stand ready to help you however we can. Thank you. Thank you, everyone.